giving them the information is a big part, right? And so we're going to reaffirm them from an education standpoint, from the doctor standpoint of, this is how many implants I think we're going to do. This is how I think it's going to go. The stuff that we've talked about so far. But then there's the other aspect, which is a lot of what you do, which is going to be, here's the paperwork, here's this, if you have any questions. So walk me through how you handle, let's just say, the 3-month diet. That's something that we talk about quite a bit. That's a softer diet. Mm-hmm. Tell me about how that goes from both you in person to reaffirming it and paperwork, and like, how do you walk a patient through that information?
So we walk the patient through that information. Kind of the first step is just making sure that they understand the importance of it, the importance of your implant integration, because we want this procedure to be successful for you. And the way that that's going to work is you have to accept it first. Our soft food diet is just anything basically softer than a hot dog or anything that you can easily cut with the side of a plastic fork. So I like to tell patients, you are not limited to just eating soups for the next 90 days. You just have to get creative with it. Anything you can toss onto the stove, kind of let it go all day long, which sometimes are the best meals anyways. So that's what you're going to want to stick with. We reiterate that pretty much through the whole way through the consultation, as well as just the process of being in the office. It's in a ton of our paperwork, and we do follow up with it. We want this to work for you, so that's the first step. And
the way in which you present it is important too, right? You want to present it in this friendly manner, but also professional and clean.
Yes.
As you know, actually, what is my number one pet peeve as it relates to treatment planning and giving over paperwork? Number one thing. Do you know?
I don't know. Do I do it?
Yes, you do. What do we not do with the instructions? We don't copy them on a copier, right?
Yes.
So all of them are printed on color correctly from the file.
Yes.
One of the things that always drove me bananas was working in an office that this is the most important diet. You have to follow these rules. You have to follow this 3-month diet. It's the most important thing. So you're giving the patient a signal. This is the most important thing. But then we would give them a sheet of paper that had been copied about 7,200 times. Mm-hmm. You could see where they had whited things out in previous. Maybe they added a Post-it note. It slid off to the side over time, right?
Yes.
Like, I'm not crazy. This is one of my pet peeves, right?
Yes, it's part of the most important information. But if you don't treat it as such, it might just be overlooked.
Right.
As we've learned, it's pretty common to get handed, 25 pieces of paper, because we have a lot of general consent forms, of course, and they just easily get signed and tossed out because you're not actually reading what's going on. So definitely the way that we like to do it is verbally. We touch on the soft food diet a lot in the consultation. It's honestly one of the first things that I do go over because I want to enforce that it's important.
Yeah. I think that for treatment planning, it's important to know that your care team, will say, your professionals, the people that you choose, are on top of their game. That's the first thing you want to choose. If you're choosing a team or a procedure of any sort, be it facelift or teeth or hair transplant, whatever it is, you want your team to be the best in the world, right? But second, you want them to have a good communication pathway that allows you to feel comfortable and solid in that decision, right? Mm-hmm. As an example, my wife just went to a doctor this week, and she loved the doctor, but she waited for him in the waiting room for an hour and a half or an hour and 45 minutes. Gosh. The staff was rude. The paperwork was a mess, right? And so you have to send all of these signals have to come together at the right time, right? She's now looking for another doctor, right? Well, this one might have been the most amazing, best hands in the whole world, but they didn't have control enough of their system to get it right.
Right.
And so bringing that whole team together is of absolute imperative, vital importance, and getting that information correctly. I mean, I would say that the majority of what we try to do unique, fun, and clear is finding new ways to provide information to educate the patient for them to take care of this, understand the importance, know where their payments come out of, all of those different things, because that really leads to the success of their treatment. And so treatment planning for us is a whole lot less of the, well, I'm going to get you the doctor and we're going to pour up the models and we're going to put it on a fancy machine and we're going to show you your x-rays on the screen, because that doesn't really change anything. I'm going to still treat you as best I can, and amazingly, I'm going to do a very good job, and I know that the team will, but let's spend some time working you through the hard parts, the psychological aspect. Why is this great? Why are you going to get good results? Why does this work? How does it work? What do you need to do to take care of it? That's the important part of treatment planning, is educating the patient, to me. Treatment planning from Dan's side, from surgery side, from Blake's side, from any of the people that are going to be working, that's sort of just professional technique and preference. But it does come down to what's nice, and we kind of rely on this a lot. It's all I do. When I wake up, this is what I eat, sleep, and breathe. Yeah. And so what I see as a very easy case is going to come with, maybe it is complex for someone else, but I've already done it a bazillion times. I know how to do it well. Mm-hmm. And I think back to sort of woodworking, when I think of this, I have a CNC at home, right? And do you know what a CNC is?
I do not.
So CNC, you program the computer, essentially software, to to move the machine in a certain way that it cuts the wood, okay? So there are 3 different directions you can move in a router, like a home level router for woodworking. It goes forward and backward, left and right, up and down, okay? And so the series of instructions tells the router, which is cutting the wood, left, right, forward, back, up, down, what to do, okay? Mm-hmm. And when you're first programming this, you can program very complex cuts and designs and things like that, but executing it may be very difficult because you forgot that the machine didn't know where the bit was, right? It didn't touch the pad correctly, right? Mm-hmm. And so as you do this, and I've been doing it pretty seriously for about 2 years now, I did something yesterday on the CNC that I look back and there's no way I could have accomplished it a year and a half, 2 years ago. Not because I didn't have the skills, not because I didn't have the machine, but because I hadn't put all of the pieces together, right? Independently, I had the skills and I did already have that same machine. I haven't switched machines, but learning the hard knocks and going through the repetitions is what led me to being able to do it in an efficient sort of manufacturing type process that allowed me to cut out the bad things that happen. And that's something we've already pressed on before is, are there complications? Yes, but it's how you manage them, it's how you treat them, and how you and your patient are going to work together, right? Are there complications when I'm CNC routing on the milling machine? Absolutely. But I learned from that, move on, and then I've gotten better,